Hello, everyone, and welcome to MyCHN podcast, Health Conversations Without Barriers. Thank you for joining us for Children's Health Day. This is our last day for National Health Center Week. As you know, children are very important. Not only are they the future, but they are also the future economy. And then everything else that is coming up. As you know, there's a beginning and then there's an end. So now we're going to talk about what we do at MyCHN to set these kids for the best healthy lifestyle that they could have.
Yeah, Mariela. So I think it's very important everything that we do at our clinics for our children. Like you said, they are our future. We want to get them set to be having a healthy future. And each of our locations, when you go into PD, we talked about this before. We want to do a whole person care. So we do offer your pediatric care, your vaccines, all of that, your primary care. But we also offer dental hygiene. It's very important to get them started on their dental hygiene, their checkups, their cleanings, behavior health as well. So we also offer the behavior health part, ADH testing, TOVA testing, and stuff like that. We also offer that. And our pharmacy services, if our babies have some type of infection, we're able to get those medicines for them. So we do cater to our babies. I know we have great pediatric dentists. We do have great pediatric doctors and that cater to our kids. Now, to highlight this day, we're actually, because we are in back to school, we are going to do a vaccine event in Pasadena and bring those resources to our community. So they don't have to come to our health centers for that day. We're doing a vaccine event, but we do a lot for the kids as well. So in the summer, if you follow us on Instagram, on Facebook, we always post different events. And this goes back to our patient appreciation as well, right? So because yes, we love our kids. Yes, we cater to our kids, but it's a whole family thing, right? So in the summer and throughout fall and throughout the year, we try to do different things. So we are part of health fairs. We are part of different events going on. So now, right now, back to school. We're doing, like I said, the vaccine events. We're doing health fairs, back to school bashes, where they provide those all of those school supplies that they're needing. We're able to supply that to our kiddos. We partner up with different organizations to make that happen. And then two, we also have our pool days that we do for our patients and for our community, where we sponsor a day at the pool, at your local pool, and you're able to come in for free. We'll provide snacks and water for you to enjoy the day and provide that. So, a lot of families, I know growing up, we didn't go on vacations. We didn't do those fancy things. And mom and dad were always working. But those pool days, being out in the pool for the day was really fun. And I think that's something that we like to do for our kids. It's very important to us. And so that's how we cater to them. Not only do we want to provide their health care and everything else in between, but also that extra little fun that us kids like to do, right?
Yeah. So actually, one of the things that we are having, one of the projects for MyCHN is dental integration, right? Which is like where a child can come in, see the pediatrician, but then also see the dentist, get the dental hygienist, get their cleaning, because we know that convenience is key. Sometimes it's not that parents don't want the kids to get those services, it's just that it's time. And as you know, if they're a working family, a day that they bring their kid is a day that they probably did not go to work. That's a
Yeah.
day that's, their paycheck, it's going to be a little bit smaller in the next 2 weeks. So that's something that we want to help with, right? We don't want to impact a family's income. So definitely that is something that it helps not only the family, but also the child. And it just starts them in a very healthy, that gets them ready for a school year.
I agree. And I love that that integration that we're offering right now in our health centers. It's very important. Sometimes it's too the knowledge. Sometimes as parents, we lack the knowledge on when we need to take them, when
Mhm.
their checkups. How far in between do we need to take them? And so I love this integration that we're doing here at MyCHN, where we're able to help both child and parent through those steps, through those lives, and make life a little bit easier and not having to take that extra day off. Because as working parents, as I too, sometimes I have to take a day off of work to make sure that I take care. And I actually, I'm glad you brought it up, Mariela. When I have to take my kids to the doctor, I schedule everything in that day because it's so hard. It's so hard to take another day off, and I love that. I love that we're able to do that because it alleviates a little bit more stress from us parents, which is amazing, and I really like that.
So this concludes our 7 days of National Health Center Week. I would like to thank Miriam for being here with me.
Yes, I'm excited. Thank y'all so much for tuning in. I am very excited. Please tune in to our Facebook, our website, our Instagram, all of our social media. You're actually going to see a blog from each day, just explaining a little bit more in depth what it is and why we're doing it. And then also too, you're going to see everything that we're doing that day. We talked a little bit of what we're doing, but not in full. On each day, and you get to actually see us working on that and everything that we're doing, and I'm excited to hear from our staff, see what they have to say.
Thank you for tuning in. And please share this podcast with your friends and family or leave us a review, a faster review on Spotify or iTunes. Until next time.